This medication is prescribed to patients with multiple sclerosis, MS, to help slow down the progression of the disease and reduce the frequency of symptoms such as balance problems, numbness, or weakness. It is important to take this medication as directed by your healthcare provider for best results. The recommended dosage is usually administered 3 times a week, with the exact timing depending on your healthcare provider's instructions. It is best to take this medication at the same time on the same days to maintain a consistent level in your body. Before you start using Rebif Rebidose pen injector, make sure to read the medication guide and instructions for use provided by your pharmacist each time you get a refill. If you have any questions, ask your doctor or pharmacist. To use this medication at home, learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. To make the injection more comfortable, remove the medication from the refrigerator and let it warm to room temperature for about 30 minutes before injecting. Do not warm up this medication in any other way such as heating in the microwave or placing in hot water. Inject this medication under the skin as directed by your doctor, usually 3 times a week, at least 48 hours apart, such as Monday, Wednesday, and Friday. It is best to use this medication near bedtime to reduce side effects. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. Do not inject into skin that is red, sore, scarred, or infected. Inject this medication in the thigh, abdomen, buttock, or the back of the upper arm as directed by your doctor. Tell your doctor of any skin reactions that do not go away after a few days. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same time for each scheduled dose. Tell your doctor if your condition gets worse. If you experience pain, redness, or swelling at the injection site, make sure to inform your doctor. Many people may experience flu-like symptoms when they first start using this medication, such as headache, tiredness, fever, chills, and muscle aches. These symptoms usually last about a day after the injection and improve or go away after a few months of continued use. To lessen these side effects, you can inject the medicine at bedtime and use fever reducers/pain relievers such as acetaminophen or ibuprofen before each dose. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. If you have any concerning side effects, such as mental/mood changes, feeling too hot or cold, joint pain/swelling, or signs of infections, make sure to contact your doctor right away. And if you notice any symptoms of a serious allergic reaction, seek medical help immediately. Before using Rebif Rebidose pen injector, it's important to talk to your doctor or pharmacist about any allergies you may have, especially to human albumin. Some brands of this medication contain albumin made from human blood, which has been carefully tested and goes through a special manufacturing process. However, there is an extremely small chance of getting infections from the medication. It's important to inform your doctor or pharmacist about your medical history, especially if you have any bleeding or blood problems, heart problems, liver disease, mental/mood disorders, seizure disorder, or thyroid disease. Rebif Rebidose pen injector can make you more susceptible to infections or may worsen current infections, so it's important to stay away from anyone who has an infection that may easily spread. It's also important to inform your healthcare professional before receiving any immunizations/vaccinations, and to avoid contact with people who have recently received live vaccines. If you are pregnant, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. This medication may also pass into breast milk, but is unlikely to harm a nursing infant. It's important to consult with your doctor before breastfeeding while using Rebif Rebidose pen injector. When using Rebif Rebidose pen injector, it's important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure that you are using Rebif Rebidose pen injector safely and effectively. If someone has taken too much Rebif and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Rebif Rebidose pen injector with others. Make sure to schedule and attend regular lab and medical tests, such as complete blood count, liver, and thyroid function tests, while using this medication. Keep all medical and lab appointments to monitor your health. So, if you happen to miss a dose, you can use it as soon as you remember, and then just skip the next day. It's important not to use this medication 2 days in a row, and also not to double the dose to catch up. Just make sure to follow your usual schedule the next week. As for the best time to take Rebif Rebidose pen injector, it's best to consult with your healthcare provider to determine the optimal timing for your individual needs. Remember to carefully follow the dosage instructions provided by your doctor for the best results. When storing Rebif Rebidose pen injector, it's important to keep it in the refrigerator away from light, but be sure not to freeze it. If needed, you can also store it at room temperature for up to 30 days, but keeping it refrigerated is the better option. Make sure to avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, be sure to properly discard the product when it's expired or no longer needed. If you're unsure of the proper way to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.